to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Reid Winick, speaking on holistic dentistry during pregnancy and beyond. Dentistry for Health New York is a green and sustainable dental practice designed as a haven for overall wellness. Their whole-body program of sustainable dentistry treats the patient as a human ecosystem. Patients from all over the country seek out Dr. Winick's personalized treatment systems for a second opinion regarding additional options in their treatment on how to save their teeth without painful gum surgery and extractions. Patients report that Dr. Winick's sustainable wellness programs have virtually eliminated the need for them to have periodontal surgery, the need for dental implants, and improved overall wellness. In addition, Dr. Winick has established a sleep disorder breathing program as a way to help patients eliminate hidden inflammation. Dr. Reid Winick is a national lecturer to medical doctors and other healthcare providers. For more information about his practice, please visit dentistryforhealthnewyork.com. Welcome, Dr. Winick, to the show. I'm so excited to have you on today.
Hi, Laura. Thanks for having me.
Yes. So today's topic is going to be focusing on holistic dentistry. And, especially for our audience, we're talking preconception, pregnancy, and beyond, as well as early childhood dentistry as well. So I'm excited for you to share your knowledge and wisdom around this topic today.
You're very welcome. I hope we can cover it all in an hour.
Me too. We'll do our best.
Okay.
So I'd love for you to just start off by sharing with our audience a little bit about who you are and kind of your personal journey of how you got into becoming a holistic dentist.
Sure. Well, if you go back to when I was very young, as a child, I was always having stomach aches, and I was always constipated. And for years growing up, I was treated with the basic allopathic model just to deal with the symptoms that I was suffering from. And then when I got into college, my symptoms got so bad that I was rushed to the hospital with a really bad stomach pain. They looked at my appendix on the x-ray, said everything looks normal, but you have all the symptoms of appendicitis. Let's take out your appendix and see how you do. When I woke up, I was told my appendix was fine, but you have Crohn's disease. And so that was in 1980. So all the years going on, I was now treated as a Crohn's patient with steroids and different medications and antibiotics every day. And I went through college, and I was okay. I would get bouts that would come and go, and I would miss part of school and have to make it up during the summer. But I was okay. But then it got to a point when it was so bad, now it was affecting my small bowel, and they decided to do an ileocecal resection. So once they did that, and they took out about a foot of my small intestine, I actually felt great.
You're young, too, right? You're in your 20s.
Yeah, I think I was maybe, it was so long ago, I don't remember, maybe in my late 20s, yeah. And what was amazing is I felt great, and my whole thing, and they like to do it as late as possible because they know it's going to happen again. They guarantee you'll need surgery again, so they wait as many years as possible. So you have it, let's say, in your late 20s, and then you have it again in your 60s, and by then, who cares? Because you're not going to have the next surgery. So, but I felt so great. I was like, we should have did this years ago, because every time I would eat, I would get like a stabbing pain in my stomach. I never wanted to eat. I used to weigh 130 pounds. I couldn't keep my food down. It was just a mess. And throughout those years, I took off a year and I missed dental school. I had to repeat the first year of dental school. It was never like, I can't wait to go out to dinner with you, because eating wasn't fun. So after that resection, I was doing really well. But then now I'm in practice, and the infection went into my rectum. So then I had rectal surgery, and it takes 6 months to heal up from rectal surgery. And during that 6-month period, I have night sweats, and it was just a mess. I don't
You're
even
not able to
discuss
work
it.
either.
Well, the way I would work was I'd work for an hour and sleep for 2 hours because I had to support myself. So I had to be at work. And eventually, after that 6-month period of the first rectal surgery, all the symptoms and all the problems came back again. So I had another surgery by a different physician. And again, waiting 6 months, almost 6 months to the date, the symptoms came back again. And I had planned I was feeling better, so I'm like, okay, let me get back and learn about, I was studying patients who have TMJ dysfunction. So I went to the academy meeting, and I can barely sit. I was so uncomfortable, I can barely sit in the auditorium because all my symptoms were coming back again. And there were 2 doctors talking about treating chronic pain patients and Crohn's disease and mercury fillings. And I'm like, what is this? And they were saying Crohn's disease is caused by a gluten allergy. So after the seminar, I went up to one of them, and they did some muscle testing on me and said, oh, you have an allergy to gluten. They did some NET on my neck and said, you have these emotional issues. She cleared those. And I told my wife what was going on, and she's like, in 5 days, after eating no gluten, all my pain, all my drainage, everything, all my night sweats went away.
Wow. And
I went to my physician, and he said, well, you're definitely doing better than you are right now, but let's do a biopsy to see if you do have celiac. And I'm like, what's celiac? He's like, well, babies get an allergy to gluten. It would have been nice if they would have tested me 20 years earlier, but anyhow. So I came back again a week later, and he says, nope, you don't have celiac based on this biopsy we did, but you're definitely doing better, so keep doing your diet. And I pointed to my wife, who is also being treated now for stomach bloating and constipation. I'm like, well, shouldn't she be gluten-free also? He's like, no. She's not as bad as you are. Hence, waiting for our symptoms to really show a dysfunction. So I'm like, okay, thank you. And the 2 of us, we flew out to Seattle where this doctor was, and she treated me. I changed my diet, and she gave me a bunch of nutrients, and I got rid of all my mercury fillings, and I changed some other dentistry. And I've been fine ever since and doing great. So once I learned, because according to their philosophy, there's a very large dental component to overall wellness.
Okay.
So I then took all their seminars and learned about dentistry from their point of view, and then I took some other dental holistic seminars from other doctors in the areas, and I created what we have today. It's a holistic, I call it really a sustainable dental practice, because we're really more interested not just in the whole mercury fluoride issue, but on helping and teaching patients how to become sustainable and maintain their body and be healthy, not just, oh, you have a mercury problem, let's figure that out. So we've broadened the scope, hence I use the word sustainable dentistry. And what this reminds me about is really the crux of the 2 things that we're taught, the 2 differences between the allopathic model and the functional model. And if you're sitting by your desk and you're writing, you have a pen and paper, I assume you're taking notes. If the allopathic model is basically symptoms going to disease, going to dysfunction, where the functional model is dysfunction going to disease, going to symptoms. So if we give the example of me when I was younger, right? So what was my symptoms? I had constipation and stomach aches. Over time, it eventually developed, they discovered, oh, you have Crohn's disease. And then over time, the Crohn's disease developed into a dysfunction. They had to cut away part of my small intestine. So how does that look with a patient who goes to the dentist? So you see your dentist or you see your hygienist, and they say, oh, you have bleeding gums. Symptom. Bleeding gums, if left untreated, lead to periodontal disease, which is bone loss and gum infections, right? And then eventually what do they do with that dysfunction? They cut away your gums. And that's their way of treating it. So let's flip that around. So if you first look at the dysfunction is something you have that you don't know you have. It's hidden. And you have to find somebody, a caregiver or yourself, to dive in and do some detective work and to discover, is there an underlying infection or underlying something going on with this patient that he doesn't know he has, but we want to identify it now before it becomes a bigger problem. So in our model for dysfunction, it will be unidentified bacteria. So we do bacteria screening. We do that because this bacteria can lead to inflammation. And it's this inflammation that can either cause bleeding gums, but it can also affect your baby when you're pregnant. So we want to identify this before you even get pregnant, and then we can deal with it so that when you have your pregnancy, you don't have the complications associated with undiagnosed or hidden inflammation.
Wow, that's so important. I know you have a big focus in your office of, helping women preconception, right? Because that's definitely, once again, more of a functional medicine modality of prevention, right, as opposed to waiting until someone already has an issue and now they're pregnant and it might be harder to treat.
Right. True. Well, yes, go on.
So I was just going to say, can you share some of those, top concerns that you would work with a woman, let's say, even before she's pregnant, that can help prevent her from having issues?
Sure. Okay, so let's look first at the gum disease issue. So we see a lot of women today who are trying to conceive and they can't. And they're going for, I forget what you call it, when they go to
IVF.
They go for IVF, right, exactly.
Yeah.
And it's expensive. And they go through the treatment once and it doesn't work. And they say, okay, well, you can try it again. Our whole premise is if you have an infection or if you have inflammation in your mouth, my feeling is that's going to make it more difficult for you to conceive because a baby wants to live in a healthy environment. Right. So what we would do is run these salivary diagnostics on the woman and see if they have a lot of bacteria in their mouth. A lot of times, if they do, we would also send them to their a parasitologist to see if they have parasites. And because the oral cavity and the rectum, it's all one tube. The digestive system is all attached. So if we're going to treat you from the top, you need to be treated also from the bottom. So our experience is that there's a greater likelihood that the mom would conceive once you clean out the infection. Mm-hmm. Now, there's also the whole other story about dental materials and what you put in the mouth and what's in the mouth while the mom is even pregnant. So let me just premise it with, I'm a dentist. I do not make medical solutions or medical claims with my patients. My license forbids me to do that. So what I basically tell my patients is, well, if you are concerned about the mercury in your mouth, because that mercury, studies show, will definitely go through your placenta into the baby, then you need to connect with your caregiver, whoever that might be, and start asking these questions. Am I mercury toxic? Is mercury a concern with my baby? And if that person understands the research that we're talking about today, the answer would be yes. And then the next step would be, well, then before you get pregnant, you have to go through a detox process because it can take 6 months to a year to detox the mercury out of your system. Because unfortunately, when you have a baby, all of your, I think, 3/4 of your toxins will get dumped from you into the placenta. So you want to make sure you're starting off with as clean a slate as possible.
Right.
So they would go to their caregiver. They would be put through a detox program, and it could also be a program for any other infections or other nutrients that they would suggest to support the baby. Because remember, don't wait for the problem to surface. You have to treat that dysfunction that you don't know you have before it happens. So what we would do is we would team up with your caregiver, and there's specific safe protocols to remove the mercury from somebody's mouth. Unfortunately, not every dentist knows those protocols, and those protocols need to be followed as much as you would follow the protocol that if you had asbestos in your house, right, on how they want to keep your house isolated so that more of the fumes don't escape. So because there are people who would say that by taking the mercury amalgam fillings out, you get more exposure to the mercury than if you leave them in place. And that's 100% true. However, if you take them out safely and you protect and isolate the mouth in a certain way, the exposure is drastically minimized, and it's no longer an unsafe procedure.
Mm-hmm. Yeah, it sounds like that would be really important.
It is. You know, the best thing you can do besides having a baby is having a baby that's very healthy, and it's free of any kind of issues. And this is one great way of doing it.
Are you finding that dentists nowadays are still using mercury fillings?
I think the last number I saw, and I'm not 100% sure, I think 50% of the dentists are still doing mercury fillings.
Wow, that blows my mind.
Yeah, but for me that's pretty good because it was a lot higher. But a lot of the dentists who aren't using mercury fillings, it's more, a composite filling or a porcelain filling is far more supportive for a tooth, number one. Mm-hmm. But it's also more aesthetic. So there's a lot of aesthetic dentists that are bowing out of using amalgam, not because of the mercury controversy, but because it's just a gray filling and doesn't look nice. So they don't even want to put it in their patient's mouth. It's not really for a health reason. But what's happening is if the patient goes to this type of aesthetic dentist and says, hey, I want to have all my amalgams removed, my mercury fillings removed, and put in tooth-colored fillings, he's not going to remove it safely because he doesn't, A, believe that they're a problem, but also he doesn't believe that you should isolate the person. He doesn't have the techniques to do it in a safe way. So you have to be careful on who you choose to have remove your amalgams for whatever reason.
That's a good point. Like if someone listening in who doesn't live in the New York area and can't physically come to your office in New York City, is there a website that has like holistic dentists listed that would have a safe protocol for removing mercury amalgams?
Yeah, there's a website. It's the International Academy of Oral Medicine and Toxicology. Their website address is IAOMT.org. Mm-hmm. Okay. And you also have the Holistic Dental Association, which I think it's a .com, but they can do a Google search on that. Mm-hmm. And if you're looking for a dentist who understands the oral systemic connection between inflammation and infection in the mouth, and can treat your gum disease in this manner, you can go to AOSH. I think it's AOSH.com. It's AAOSH. And I believe that's .com. So they've trained and they have dentists who belong to this group that don't necessarily understand the mercury amalgam concern, but they should be well versed in understanding how to deal with infections in the mouth and how they affect the baby and other systemic problems.
Mm-hmm. Okay. So, yeah, both of those are really important. You had mentioned a little bit about fluoride as well. Do you want to talk about that a little bit more?
Sure, why not? So first of all, I have a pediatric dentist in my office, and the way that she handles, well, let's just take one step back. We don't like fluoride across the board. There's no fluoride in my water. There's no fluoride. We don't use fluoride tablets. I'm not a believer in fluoride. I believe it does more harm than good. However, my pediatric dentist will do a technique where she spot treats a child's teeth that seem to be having some decay, and she spot treats them like 3 weeks in a row, I believe. And it's not like what we grew up with, where we have these big fluoride trays in our mouth and we're like sucking on the fluoride and stuff. It's very, very small, and it's a very minute amount. And the pediatricians in the area that we work with know the process. They said it's okay to do, and it's fine. Because our feeling is she'd rather do this for a child than put them through the process of having their teeth drilled and getting a filling. Even though we use a composite filling, the best dentistry is still no dentistry. So she spends most of our time with young moms, young children, teaching good home care techniques, number one, but also she teaches and looks at their diet and looks to see how often they're eating, they're snacking, because remember, if your teeth are decaying, there's a bigger process going on than just your teeth decaying, and we want to try to identify that. So she'll go through their nutrition and other aspects of their breathing to see what's happening with the child.
So important. I love that. I love that it's, very much holistic oriented. And, if we do think about, cavities and the cause of cavities, especially with kids, right, a lot of it is very much diet related.
Right.
Sugar. Yeah.
Right. Well, a lot of it is frequency. I just don't like the idea of like a child sucking on a lollipop, because it's in their mouth for like 15, 20 minutes. So just enough, if they're going to eat something, eat it quickly and then rinse their mouth out of something. But it's that ongoing sugar in the mouth which causes the pH of the mouth to become more acidic, and then that allows the bacteria to thrive and the whole process of decay starting.
Right. I know we were talking earlier, too, about kind of best practices for new moms to be familiar with regarding their child's dental care. Can you share a little bit about that?
Sure. So in terms of their toothpaste, first of all, you can't use any toothpaste on your child until they can spit out. There's actually now warnings on toothpaste about fluoride, that it can cause harm to the child. So make sure before you implement any toothpaste they can spit out. Also, you want to use like a pea size amount. You don't need a lot. Also, I'm a firm believer now, also without using any sodium lauryl sulfate in the toothpaste.
Or fluoride.
Or fluoride, or even like aspartame, like these artificial sweeteners, because they can have an effect also. So also what's important, though, it's funny, because with my adults, I tell my adults not to floss. It's just when it comes to gum disease, and that could be a whole other topic, it's just a waste of time. But for the kids, my pediatric dentist is like, no, you got to floss the teeth. And the reason she gives is because baby teeth are flat, and there's more contact between them. So the floss will help get between the teeth much more effectively than even the brushing. So she's a big advocate of flossing, but when they get older, they don't have to floss anymore. One of the biggest frustrations that moms have, or even dads have, is getting your kids to brush their teeth. I have 2 kids, and I went through this with it before I knew this. So one trick that I learned about was when the child is old enough, and you'll determine when they're old enough, but this is before their first tooth comes out. When you're cleaning their face, when you're cleaning them up, you can take like a wet washcloth and just rub it on their gums. There's no teeth, but you're going to rub it on the gums, and you can make it fun and say, oh, we're cleaning your teeth, or whatever you want to say to have fun with your child, because what that will do is that will signal the brain for them when they get older to brush and want to clean their teeth, because this is what mommy did for them when they were younger. So you don't have to wait for a tooth to show before you start massaging the gums. And that's all you're doing. You can just do it for a few seconds, upper and lower, and make it fun. We used to think years ago that the child should go and have their first visit when they're 2 years old, when most of their baby teeth have come in. Now we say come in at 1 year old, and some even say come in earlier, because we want to educate the parents on proper oral care for your child. And in that case, the earlier they come in, the better. Also, we want to see how well the child is breathing. We want to see if there's any tongue tie, which could have make latching on more difficult. So there's a lot that we can do before a tooth erupts. So, for instance, if a mom is having trouble with their child latching on and they want to breastfeed, then I would go to your dentist who understands, your pediatric dentist, and have them look at the tongue to see if it's tied down. Because if it's tied down, then they can't latch on, and that's the functional part that needs to be fixed. And there are specifically trained dentists that use a laser, and they cut the frenum, and it heals up very easily, and the baby will start latching on almost immediately.
Yeah, I see that a lot in my office.
Yeah.
It's so helpful.
It is. It really makes a big difference.
The tongue and even sometimes the upper lip as well can be, attached, and then the doctor can just release both very quickly with a laser, and it just really allows the baby functionally to be able to get a better latch.
It does. And it does. And it makes both baby and mommy very happy.
Mm-hmm. Wonderful. So we were talking, I wanted to see if we could go back and go over maybe some other dental concerns, that would be helpful for women. Like let's say a woman's already pregnant listening to the show.
Oh,
what
great
can she
question.
do now?
Great question. Okay, so I'll go back a step. So before you even become pregnant, you have to go to your dentist and request that they do an oral DNA bacteria test and get the results and see, do you have this hidden infection, this hidden dysfunction that you want to be a detective to know if your gums are healthy enough. Because if your gums aren't healthy enough, and you now have, let's say, they're the spirochetes. Now, when I say spirochetes, I'm not talking about Lyme spirochetes. I'm talking about these other spirochetes that live in the mouth. It's their cousin. But these spirochetes, Lyme spirochetes can also pass through the placenta. But and a lot of these bacteria can go into the placenta. And part of the problem is, and the research is showing that these bacteria and this inflammation can actually cause an increase in prostaglandins. And what happens is it's the prostaglandins that are released that cause the cervix to start to open, and then you start to deliver. So if that level rises earlier, then you get a preterm baby. So it's really key for that reason to know the level.
Even.
Yeah. Well, I didn't get there yet. But it's important there, from that point, to make sure that your gums are healthy. Now, a misconception is that there's an expression, you have a pink, when you're pregnant, you have a pink toothbrush. that pink is really, it's bleeding. Your gums are bleeding. That is not a sign of health. So put away, it's okay to have a pink toothbrush. It's not okay to have a pink toothbrush. What we recommend our patients to do to have even healthier gums is to use a water pick or a hydro floss, which is a magnetic water pick. That will really irrigate and clean out underneath the gums and help much more than just flossing and brushing.
Right. That's what you recommend in lieu of flossing for adults.
Yes, exactly. Now, okay, so let's go back. So mom wants to see their dentist before she gets pregnant, and she wants to have a really good cleaning, and she wants to make sure that, and I don't want to go through what the definition of a really good cleaning is. You have to just figure that out yourself. But that you have to make sure they're not just shining up your teeth. They have to be really, and go to the hygienist. Hygienists love their job. They do it so well. As opposed to the dentist who's busy with everything else, but hygienists, this is their specialty, and use the hygienist. Anyhow, so you go before you have your baby, before you conceive, and then in your second trimester, you would also go back and have another cleaning. Now, it's also important to have some x-rays. We like digital x-rays because they're less radiation. Because if you have a small cavity before you get pregnant, there's a large possibility that it will get bigger much faster because now your minerals have changed since you're pregnant, and that cavity can develop faster. Plus, think about it. You were so busy before you had your baby. Now you have your baby. And now after the baby, you can be even busier. You're not going to have a chance to go to the dentist. You need to get all this done before you have your baby. Mm-hmm. And then you can enjoy your next 9 or 10 months.
Mm-hmm. And then also, it sounds like we had talked about kind of like what type of toothpaste to be aware of for your kids, but we could say the same for a woman during pregnancy as well, getting toothpaste that's fluoride-free, SLS-free.
No preservatives in it, like propylene glycol.
Right.
So there are two toothpaste that I would recommend is you can find some clays out there that are really good, clay toothpaste. There's also another brand, it's called Clean Kiss. I think if you go to cleankiss.com, they have a great rinse that you can put into your water pick or your hydro floss, and they have a great toothpaste that has vitamins in it, and I know the person who developed it. It's very clean. It's very pure, and those are the two brands I would look into. Also,
the clay one, which I use based on your recommendation, the brand is Oralive, right?
Yeah, from Ascended Health.
Ascended Health is the brand name, yeah.
Right.
It's weird. It's like you're literally putting clay on your toothbrush, but it's magical.
It is.
It's really good stuff.
It's great. But see, what's key is what we do here in the practice is we don't know if it works unless we keep testing for that infection. Because it might work for you, Laura, but it might not work for somebody else. So we always test to make sure it fits.
And it does work for me. I know when I had you had checked my gums and I had spirochetes, and then I started brushing with the clay, and it cleared up. So it definitely worked for me.
Yep, and that's why you're going to keep on it.
Yeah, that's right. It's worth the investment. So I think it's good for women listening on, I think, and once again, culturally conditioned, toothpaste is all the same, right? And we have, the major brands, Colgate, Crest, whatever, that are, advertising, and we just think that, sure, that's what we'll use for pregnancy. And there are other options out there, and you can find them at your health food store, Whole Foods, or online, and, be a smart consumer about what you're using, because even though you're not swallowing it, it still gets absorbed into your body.
Right. I just thought of another tip for anybody who has the mercury amalgam fillings in the mouth, especially if your mom is pregnant. When you go for your cleaning, we were taught in school that you got to take out that rubber cup and re-shine up that mercury amalgam filling. That spews out so much mercury vapor. So I know the hygienists here are trained never touch the filling. Leave them gray if a patient has them, because that's the safe way of handling it. So when you go in for your cleaning and you're pregnant because it's your second trimester, make sure they don't bring out that rubber cup and start shining up your fillings. Just leave them alone.
Oh, and if you work with a dentist who knows how to properly, safely remove the amalgam fillings, can that be done during pregnancy?
Definitely not.
No, you wouldn't. Even with a safe protocol, it's still not safe enough.
Nope.
You'd say wait till after the baby's delivered.
I would, right, exactly. It has to be done beforehand, and I would even, you see, the best, when a patient comes to my office and says, I want to take out my mercury fillings, my first question is why? And they can say, well, I read about it. I'm like, okay, great. Go to your doctor and let him tell you you're mercury toxic, because you could have a mouthful of mercury in your mouth, a mouthful of mercury fillings in your mouth, and not be mercury toxic. What does that mean? You're excreting the mercury naturally with your own body chemistry, through your feces, through your urine, through your sweat, through your breath. You're excreting. Or you can have one tiny mercury filling in your mouth and be so mercury toxic. So the first step is really, well, let's find out where you stand in the situation. So that's the general population. But if a mom says to me, hey, I want to take out my mercury fillings, I'm planning on getting pregnant, I look at her and I smile. I say, that's the best gift you can give your child, because now you're starting them off on a cleaner slate, because we know that mercury is a neurotoxin, and it affects the nervous system. So I then tell the mom, okay, go to your doctor, get tested, get on the protocol, because there's a systemic protocol that they have to do also, whether they choose to do IV detoxification or they do vitamin detoxification. They need to do something. Even before they see me, even though I'm using all these good techniques to keep the mercury levels down when we remove the filling, I still want them to have something on board. So it's something that's done way before you're even planning on getting pregnant.
Yeah. And,
I think I detoxed my wife a year before we had our first son.
Oh, that's great.
Yeah.
That's so important.
I wasn't ready anyhow, but don't tell her.
It does sound like you were delaying being a father, but that's okay. It's our secret. I think I wanted to see if you would just kind of discuss a little bit, because I know there's some misconception out there about the mercury found in the dental amalgams. Like if it's in your tooth, like people might say, well, then how am I exposed to mercury? Like, the ADA is saying it's safe. There's, you mentioned briefly about mercury vapors. Can you just explain how that can actually become systemic?
Sure. So there's, on the IAOMT website, there's a video. I think it's called a smoking tooth video or something like that. And basically they put an old mercury filling. It wasn't new, it was old, under this blue light, and they hit it with something, and they heated it up, and they did all these things to it that you would normally do to a filling if you had hot coffee or if you were eating, and you can constantly see the vapors coming off the filling. Now, this wasn't a brand new filling, so it's not like the mercury vapors wear away after 20 years. They still come out. So, I mean, there are tests that you can put a Jerome vapor meter in front of your mouth to see how much mercury is coming off. I don't have that in the office, and I like toys, but I don't have that in the office because we know the mercury is coming off. I don't need to prove that to you. What I want to know is, are you really mercury toxic, or are your symptoms maybe related to sleeping issues or other issues, not the mercury? So mercury is coming off the fillings all the time.
All the time. It's really the body's ability, their detox pathways, like you mentioned. Some people are able to chelate that mercury out more effectively on their own, and some people are not. And
exactly.
So the ones that are more compromised are going to be more toxic.
Right. It's all up to the body, whether it's the body's ability or inability to detoxify, and that's what it comes down to. Right.
And so I'm assuming if someone went to your office, they were concerned that they may, they have some mercury fillings as a child, and they're like, I don't know if am toxic or not. You mentioned you would send them to their caregiver, but I'm also assuming you probably have functional medicine doctor relationships in case, their doctor's maybe not familiar with mercury testing that you can recommend.
Yes.
Is, there are functional medicine doctors that do that type of work.
Right. So if someone came to me and said, well, I go to Dr. X, I'm like, okay, let me talk to Dr. X. Because if he's, for instance, saying, well, I'll run a blood test on you to see if you're mercury toxic, a blood test doesn't only show it. Because if I had some fish yesterday, and let's say I had tuna yesterday, and the last thing I would ever eat is tuna, but let's say I did, I would have mercury in my blood test. So mercury in the blood is like a snapshot of what you recently had, as opposed to taking a supplement or some kind of pill or an injection of DMPS. There's many different chelators out there, and that's up to your caregiver. And then they do what's called a urine catch. They'll either catch your urine for 6 hours or 12 hours. They give you a bottle, and you bring it in, and then you send that to a lab. And it'll give you a readout of all the heavy metals that are coming out in your urine. And then you'll see the levels of the mercury or the lead that's in your, stored up in the body. And that's the way you do the test. There are some doctors that say, well, I'll do a hair test. And patients come in and say, oh, well, I have a lot of mercury because there was a lot of mercury in my hair. Now, reading in the hair sample, reading a hair test is very complicated because the reality is high mercury in your hair could be a good thing because it means you're excreting the mercury. It's low mercury in the hair that's really possibly a bad thing. So you have to make sure the person that you're going to is really well versed in this whole detoxification of heavy metals.
Right. And you even just mentioned, like, you don't ever eat tuna. You stay away from the larger cold water fish.
The only fish I eat is sardines, and I get my sardines, and I also eat my Alaskan, my wild Alaskan salmon, and I get it all from vitalchoice.com. Vitalchoice.com, because that's the only, I trust them. I don't trust the major supermarkets here. Half the time they're pushing farm-raised fish anyhow. I just don't. I just stay away from that. And I know Vital Choice, they're very reputable. They actually test their fish. Actually, I was just reading something a few days ago that the radiation from Japan has actually hit one of the fish here locally in the waters here. So you got to be careful. And that's why I stay with Vital Choice. On the other hand, though, now moms who like chocolate, be very careful where you get your chocolate from, because chocolate has levels of lead in it, and it's there. It grows. It gets into the chocolate from the bean when it's grown, and we want to minimize.
Lead in the soil.
Yeah. Well, yes. So they know that, like in Africa, there's a lot of lead. They use leaded gasoline, and so there's a lot of lead in the soil.
Right.
But they even looked at chocolate from other countries, and there's lead in these chocolates also. So, and just because someone says, oh, this chocolate comes from Sweden or whatever, it might mean it came from Africa, but it was put together in Sweden, so in Switzerland, so it's clean. No. So what we recommend our patients to do is to get their chocolate from South America. Usually South America, has the best chocolate to eat. So if you're ever concerned and you want to know if your source of chocolate is healthy, you can ask them for their lead assay, because every company must measure the lead levels in their chocolate because the FDA requires that. So they'll know what their lead assay is, and that's a good way to know. So if you're pregnant...
I honestly have never heard of that before. That just blew my mind.
I know. we found out about it by accident because when I had my first son, Justin, we would go to the health food store. We would get like Godot, I don't want to say the chocolate. We would get this chocolate, and it was a healthy chocolate. And the owner of the store said, any chocolate you have to give back to us because we just got this letter from the FDA. We have to take it off the shelves because their level of lead is too high. But they say the acceptable level of lead. They didn't say it had lead in it. They have an acceptable level of lead. So now we know that the government allows lead to be in chocolate and to be consumed. And so many people are wondering, where did I get my lead from? Right. Well, many times they are big. I mean, come on, who eats lead pencils today? And lead paint. It's just not happening.
It's not happening. And even the pipes, like the pipes aren't really lead anymore.
Exactly. So look at your chocolate.
Jeez. Well, that's eye-opening. Oh, my gosh.
Yeah, or mouth closing.
So I wanted to just wrap up the call and see if you had any last thoughts you wanted to share, and also please tell us your office information, how people can find you in New York.
Okay. Sure. Last thoughts. When you have your child, there is no book. Just be open and let your child be who they are. They're children. And treat them with really an open mind and less pressure. I think children today are under too much pressure. Let them be. With that said, if you ever want to reach me or talk to me, you can go to my website. I'll give you the easy address. It's www.D for David, F for Frank, H for Harry, N for Nancy, Y for Yellow.com. And my phone number is 212-973-9425.
Dentistry for Health, New York.
Yep, .com.
Yeah, .com.
Yep. Okay. Or just DFHNY.
Thank you so much for coming on the show today and sharing all of your passion and wisdom regarding holistic dentistry. I definitely learned some new things today, so I appreciate your time.
I appreciate you, Laura. Thanks for bringing this out to everybody.
Yep, thank you.